do better, and we will. Starting this week, the federal government will set up emergency testing sites in areas that need additional testing capacity. Before Christmas, the first several of these federal testing sites will be up and running in New York City, with many more to come. This free testing is going to help reduce the waiting lines, the time you have to stand there, and sometimes it's an hour or more. We're going to continue to add federal testing sites where needed, so that if you want an immediate test, there'll be a place where you can go get it. We also need to do better with at-home testing. So I'm announcing today the federal government will purchase 500 million, that's not million, billion with a B, additional at-home rapid tests with delivery starting in January. We'll be getting these tests to Americans for free, and we'll have websites where you can get them delivered to your home. We've arranged for it to be easier for you to find a free COVID testing site near you on Google. Just enter COVID tests near me in the Google search bar, and you can find a number of different locations nearby where you can get tested. We're going to continue to use the Defense Production Act, as we did earlier this month, to make sure we're producing as many tests and as quickly as possible. The bottom line is it's a lot better than it was, but we're taking even more steps to make it easier to get tested and get tested for free. Next, we're preparing hospitals for what's coming. Those 40 unvaccinated adults have a good chance of getting COVID-19, and some of you will get very sick. That'll mean hospitals are going to get extremely stressed again, both in terms of equipment as well as personnel to care for those who get sick. That's why my administration has stockpiled and pre-positioned millions of gowns, gloves, masks, and ventilators. We call it PPP. We're ready to send them immediately to any state that needs more. In addition, I've directed the Pentagon to mobilize an additional 1,000 troops to be deployed to help staff local hospitals and expand capacity. That's 1,000 military doctors, nurses, and medics. We've already started moving medical teams. They've already landed in Wisconsin and Indiana this week. And this is on top of 300 federal medical personnel that are now on the ground, having deployed since we learned about Omicron. Look, while we know staffing is the biggest need for hospitals, some may need more beds as well. We're prepared. I've directed FEMA to activate the National Response Center and begin deploying teams now to provide additional hospital beds. We'll begin to construct emergency capacities near hospitals, in parking garages, and nearby buildings to be ready if needed. And the federal government is paying for all of this, period, all of it. Further, FEMA will deploy hundreds of ambulances and EMS crews so that if one hospital fills up, we can transport patients to beds elsewhere. This week, we'll send dozens of ambulances to New York and Maine because the COVID is spreading very rapidly to help transport patients. Our doctors, nurses, hospital staffs have gone above and beyond during this pandemic. The strain and stress is real. I really mean it. It's real. And we'll have their backs, though. We have to let them know we have their backs. Finally, we're making sure that COVID-19 no longer closes businesses or schools. Last week, the federal court reinstated my administration's vaccination or test. The vaccination or test rule for businesses with more than 100 employees. The rule requires employers with 100 or more employees to protect their workers who are on site and indoors with the requirement that they be vaccinated or tested each week or go home.